While each situation is different, there are principles of proper bandaging that are common to all situations. Depending on the situation and the materials on hand, you will probably have to be creative and adaptable. Your first priority is to cover a wound to protect it from further injury and to stop bleeding. Keep the wound as clean as possible. Either wipe or wash dirt from a wound, but don't attempt to remove impaled or embedded objects. A dressing is the material you use to cover a wound. Dressings should be as clean as possible and sterile if at all possible. Keep dressings free from debris or dirt as you prepare them. If the injury includes an impaled object, you should leave the item in place. Secure it with dressings and bandages, and then transport the patient to advanced medical care. The only time you would want to remove an impaled object from a wound is when the object is penetrating through the cheek. In this case, pull it out and dress the wound on the inside and outside. When you are dealing with an abdominal injury where internal organs are exposed or sticking out, don't touch the organs or attempt to replace them. Simply cover the organs with a moist dressing and protect the patient from further harm. You can flex the patient's knees and hips to relieve tension on the abdomen, assuming you don't suspect spinal injury. The dressing should completely cover the wound. Tape bandages down so there aren't loose edges that could catch and pull the wound open. When applying a bandage, begin wrapping from the farthest point away and move toward the heart. If possible, you should remove all jewelry on the appendage, as it can cause problems should the injury cause swelling. Bandage the wound securely so that dressing isn't able to slip and shift. However, be careful not to interfere with circulation to any extremity beyond the wound. You will need to monitor the pulse and motor function beyond the bandage before and after you apply the bandage. When you are covering a small wound, don't simply cover the wound itself with the bandage. Spread the bandage out for several inches on either side of the wound to avoid creating a pressure point. Ensure that adhesives are placed on intact skin and not on broken or wounded skin. If you are applying a bandage across a joint, bandage the joint in a comfortable position, but in the position in which it will remain. Don't try to move a joint after you apply the bandage.